workshop. My name is Hassan Ali. I am the Associate Director with Action Against Hunger Canada, also the Global Lead for the SMART Initiative. Today I will be co-chairing this the second day of our workshop with my colleague Louise. So we can maybe just quickly start with introductions from the colleagues who were not on day one. Maybe we can start with Alex, since you can see on my screen.
Hi everyone, I'm Alex Hutchison. I'm the Director of the Data for Children Collaborative with UNICEF. So we're based in Edinburgh in Scotland.
Thank you, Alex. Is there anyone else who was not on day one? I think everybody else was here. Okay, so just to quickly do a summary of what we discussed in day one. We started with a broad introduction of what we are intending to achieve in these 2 days. We'll kind of end the workshop also with that presentation, a presentation from Anna, just to wrap up or close the loop. We had a presentation from IPC on how the current IPC forecasting is being done, not necessarily using artificial intelligence. That was more to set the baseline, or to understand what's the current status in terms of forecasting and the practices that are being used. We had an interesting presentation from our colleagues from UNICEF on geospatial data solution for humanitarian action, which really looked at how they're leveraging on collecting and collating geospatial data. We had a presentation from our IPC Atari colleagues, the Advanced Technology and Artificial Intelligence, where they have done a very interesting exercise in relation to mapping of different artificial intelligence products for data aggregation, reporting, and so on and so forth, which, I mean, they have identified some low-hanging fruits that they're already exploring in terms of next steps. We had a presentation from our colleagues from World Food Programme on the hunger map, which really demonstrates how visualization of information using artificial intelligence, but also how they're using data science to kind of design these predictive and forecasting algorithms. We had a presentation from Action Against Hunger colleagues on the modeling early risk indicators to anticipate malnutrition. This now brought this sort of narrowed down the use of AI and more specific to nutrition and nutrition indicators. The Meriam project has been there for 4 years. It's more a research project. It has proven that it's possible to do forecasting using designed algorithms and artificial intelligence. And now there's a need to determine what are the next steps for this project. We had South Sudan, our colleagues from South Sudan, who presented a modeling approach that they have recently tested in South Sudan in relation to anthropometry data. And that's where we closed our day. So Anna closed the day with a sort of a wrap up of what day one looked like. Day two, we're now going to continue with some presentations. We'll then have some time, about 45 minutes, to discuss and really define the forecasting problem for the Global Nutrition Committee, and chart a clear way forward for ourselves. And I think that after hearing from all the presenters, we should be in a position to really have a very fruitful discussions. So I'm going to invite now Louise to take us to the next stage. Over to you, Liz.
Thank you, Hassan. So thank you, everyone, and welcome again to the sessions for today. So thank you, Hassan, for giving us an overview of how day one went. And as you've mentioned, I think today we'll be having two more presentations from two colleagues, and then get into kind of having a discussion in terms of the way forward and how we can shape this work moving forward. So at this point, I would like to hand over to Alex, who will be giving us a presentation on some work they've done on overweight and obesity. So Alex, over to you.
Yeah, I'm just moving on to sharing my screen, so hopefully everybody can see my slides. So yeah, thanks for having me to this session. Really great to be able to present our project to you. And what I'm wanting to take you through today is just a little bit of background about who we are, the Data for Children Collaborative with UNICEF, and then go into some detail about an obesity project that we've run in Scotland. I'm going to heavily caveat it with, as the director of the Data for Children Collaborative, it's a different principal investigator that's run the project and that could give you a lot more detail on the techniques and methodologies used, but I'm going to go through it from my layman's point of view, and hopefully that will still be useful. So when it comes to questions and answers, don't be surprised if I have to come back to you in terms of answers to some of your questions if they're a bit more technical. And also the other caveat that I'm going to mention at this point is that we haven't published the output of the project yet. So I'm not able to get through to the results stage of this for you, just on the basis that that publication needs peer reviewed, etc. But hopefully you'll get enough out of this presentation to understand what we've delivered and what we can expect from that publication. So the Data for Children Collaborative with UNICEF is a partnership between UNICEF, the Scottish Government, and the University of Edinburgh. So currently hosted by the Data Lab, which is an innovation centre, which is, all affiliated with the University of Edinburgh. You could think of us like that, if you like. And those three organisations have come together to look at how can we use data and data science to improve outcomes for children, and how can we deliver those projects in a really responsible way. So we like to use those three partners in the organisation and their extended networks and build collaborative teams to look at certain themes and priorities in new ways using data. So today obviously we're talking about nutrition as our topic, and we focused on overweight and obesity in this particular project, but we also work on things like population, poverty, mental health, climate change, COVID-19. So we've got projects running on those topics live at the moment, and it's global. So we focus in on different countries. We've got a few projects based in Africa. We've got one kicking off on mental health in Jamaica, and then some of our projects are based in Scotland. So we, very much mirroring UNICEF in terms of that global challenge, and how are we going to make sure that our impact is felt across the globe, and targeting the SDGs that UNICEF are obviously, guiding our way of what our priorities are. So that's kind of who we are and a bit of background to us. In terms of our nutrition project that we've done recently, we've been doing an analysis of a survey in Scotland, and that survey is called Growing Up in Scotland, which is a cohort of children, and we're doing an analysis of that survey to inform the design of obesity and overweight surveillance systems internationally. So that's the kind of title of the project. Just to go into a bit of background around the problem in Scotland. So in Scotland, we've got about a quarter of children starting school overweight or obese. So at the age of 5, we've got a quarter of children starting school overweight or obese. But interestingly, the poorest children are over twice the risk of the wealthiest being obese. And that's changed actually in the last few decades, because the rates used to be similar across socioeconomic levels, but that's really changed so that the poorest children are at a much higher risk now. And it's believed that an influx of the processed foods in our supermarkets means that that's where it's driving to be more of an issue for disadvantaged families. So in Scotland, we've only got routine height and weight measurements are taken in school at the age of 5 or 6 in primary 1. And that differs to our English neighbours who take a read at about the age of 12, I believe, in secondary school. So even just our one hit at school at that early age is difficult. We have difficulty getting parental acceptance to undertake the height and weight measurements, difficult to cover all the pupils, and making sure that the measurements are done consistently and of a high quality, and also avoiding stigmatization of children, which may be a reason for why we don't do it at a later age. So the driver behind this project and the thought behind this project was that, a lot of countries have not quite got it right in terms of successful methods by which to regularly monitor height and weight at a large national scale. And so the hypothesis here is really that could a validated predictive algorithm based on routinely collected and university available data provide high quality predictive and outcome data. So the Growing Up in Scotland survey that we've used for this project is a survey that's run by the Scottish Government, or commissioned and funded by the Scottish Government. And it started in 2005 and has tracked the lives of a sample of children from infancy through to their teens. So we're ultimately asking questions to understand characteristics, circumstances, and experiences of children and their carers to get a better understanding of how children's lives are starting and where that takes them in their longer term prospects and development. So there's about 3,430 children in the Growing Up in Scotland survey for the data that we use, so at the age of 12. And we're able to therefore look longitudinally at what's happened in terms of height and weight and the other characteristics that are featuring in this project. So the research questions that we asked in this project are: what's the pattern of risk factors for obesity at age 12? What's its strength of association with child and family characteristics routinely collected earlier in life and or previously found to be risk factors or predictors of childhood obesity? And what's the predictive validity of a minimum set of these risk factors for obesity at age 12, which are typically routinely collected, machine readable for all children, and so could be used to screen all children at school entry for early treatment referral. So hopefully that's really clear in terms of the sort of questions that we're asking of this survey data. And there are a set of sub-questions available here. There was a bit of a focus as well on whether adverse and protective childhood experiences have an impact. So because we've got that data within this survey, it's a very rich data set. We were able to look at socioeconomic status, adverse and protective childhood experiences, and try and identify which are the most predictive algorithms that would be useful going forward. So this is the bit where I'm going to read out this slide, but I can't say that I would be particularly knowledgeable in some of the statistical analysis methods used. But as I've mentioned, we use the GUS cohort data. So that's taken from 2005 through to, I believe it was 2017. So looking at children in that data set that have obesity at age 12, and then looking at 21 potential predictors. So we started with 21 and basically looked at the relationship between those predictors. So the sort of things that I'm talking about are mother's age at childbirth, maternal smoking in pregnancy, gestational diabetes in pregnancy, maternal education, urban versus rural location, household income. We've got a Scottish index of multiple deprivation layer that we have across the whole of Scotland. So understanding the SIMD quintile of the residence address, smoking indoors in the family home, breastfeeding, when introduction to solid foods happened, gender, and then, as I mentioned, adverse childhood encounters and positive childhood encounters as well. So we looked at some of the missing data and, to see whether this was going to impact the study in a serious way. There was very little missing data. As I said, it's a rich data set, but it's also really high quality and accuracy in terms of the data that's collected. So there was a couple of variables that had to be removed due to missing data, but it didn't have a big impact on the study. And so there's a few statistical analysis methods used, which perhaps some of you will be familiar with. So a bivariate analysis, so looking at odds ratios and risk ratios between obesity at age 12 and the potential predictors. Also then bivariate correlation analysis, so looking at the occurrence of exploratory variables in a linear regression model, and seeing how that's correlated through analysis of predetermined degrees of accuracy. We then use predictor variable reduction through stepwise selection, so looking at the estimators of relative quality of statistical models for a given set of data, and internal validation of models by bootstrapping and application of shrinkage factors. And then we did an assessment of the discriminatory performance of the models, so trying to just assess those models against each other, looking at the sensitivity and specificity, sorry. And that has all been completed. But as I say, I cannot talk about the results as such. There's, I guess, analysis that we've done in terms of looking at the predictive validity of results, looking at whether we've got the optimum data available. So if we had the optimum data across a routinely collected set of open source data versus this survey data. So it's really trying to drive out of those predictors, of the 21 predictors that have been analysed, which ones are available to us on a regular basis routinely that we could then use to derive information to do predictive modelling and consider whether there's validity in targeting individuals at that level versus sort of universal interventions. So I will open it up to questions from you now, just referring back to that caveat of not too technical questions, please, would be my request.
Thank you so much, Alex. So colleagues, do we have any questions or maybe first even just clarifications on the PowerPoint? I'm gonna have to...
I do have a question. Although I don't know whether you can answer it or no, without going to any details. So did you manage to find a correlation with at least something or no?
Yes, yeah, there is a correlation across some of the indicators and a strong relationship between some of those indicators and the likelihood of obesity. And that will come out in the publication, but there was some, so at the beginning of the project, I guess there was hypothesis about which indicators were most likely, having done a literature review and identified some, that's how we came up with the 21. So, and there was some variation to what was expected, I guess, because the literature review is going to be looking at global factors, and this is maybe down to Scottish population level and some of the idiosyncrasies that we see here as in a cultural context. And so that slightly altered the results that were anticipated, which is quite interesting. Yeah.
And so your data set was, let me try to formulate the question. When you compared results for the obesity and all the risk indicators, did you compare it at the same children, or you just wanted to get the same prediction at population level?
So this was done on a set of about 3,000. I think once the missing data was removed, there's about 2,800 children. And that's across, what's really good about that survey is it is across what a really representative population of Scotland. So that analysis was done down to the individual level, all anonymized, disaggregated data, but getting it down to that individual household level to be able to perform the predictive value of the model. The question then to sort of government colleagues and policy colleagues is that a road that they would want to go down in the future, is using those indicators to look at this on a targeted individual level output. And that is a really interesting question, I think, for Scotland to consider, because we have a lot of interventions in play at the moment, things like governmental messaging around 5 a day, or in our free school meals, the sort of nutritional content of our school meals. We've got things like a sugar tax on our fizzy drinks. So these are things that are underway already in terms of universal interventions, but there would need to be a lot more consideration as to whether you wanted to do modelling to be able to predict on an individual level and the risks associated with that. So the accuracy of the model and the targeting of individuals and the stigma that goes with that. And so that's a really interesting area for us to think about, follow up and focus going forward. Yeah.
Mm-hmm.
Thank you.
Thanks, Alex. I did see, sorry, Anna, are you done?
Yes, I'm done. Thanks.
I did see there was a question from Victoria in terms of the timeline. So do you, maybe, which was also something that I was wondering when the results would be.
So the submission was made in January, and by all accounts, it's a sort of how long is a piece of string thing of how long it takes to peer review a particular publication and we've submitted to 2 journals because we've kind of got 2 outputs. One is the predictive modelling piece and one is to talk about the adverse childhood experiences, positive childhood experiences. So we're anticipating sort of 9 months would be our, so 9 months from January. So hoping for, I know, exactly, that's the right set of eyebrows to raise. It's an incredibly painful and long process, which is unfortunate. We are going to publish a blog about it tomorrow, because tomorrow is International Obesity Day or World Obesity Day. Mm-hmm. So we're going to publish a blog on our news page tomorrow which will talk more about some of the content of this presentation, less technical content and more sort of conceptual. How does a country make a decision between universal and targeted intervention programs? So yeah, I can happily share a link to that when that comes out tomorrow.
Yes, please do. I'm sure we'll all be interested in seeing that. Okay, colleagues, any other questions for Alex? Just gonna check. Yeah. I don't see any hands up, and I don't see anything in the chat. Okay, if it seems not, Alex, thank you so much. You can obviously see we are all awaiting the results. So, you know, please do, once they're out, please do feel free to share them with us. I think the blog tomorrow on your work will be great if we can also share the link with.
Yeah, absolutely. I'll send that over. Yeah, definitely.
Yeah. Okay, thank you so much.
You're really welcome. I'm going to duck out of the session just now because I've got a few other meetings this afternoon, but I hope the rest of the session goes really well for you guys, and thanks so much for inviting me along.
Thank you. Thank you. This was very useful. And I think as we move forward, or if, you know, maybe people listen to the recordings or have the presentation, if there are any other kind of questions or clarifications, then we'll let you know.
Yeah. I've just had a message to send on a presentation. So what I'll do is I'll share the presentation and the blog with Anna, and then she can get it out to everybody that's on the call today.
Yes, that would be perfect. Thank you.
Great stuff. Thanks so much, everyone.
Okay. Bye, Alex. So colleagues, our next presentation is going to be done by Mara, and this is on a prediction of acute malnutrition prevalence, that some work they've been doing.